Today we are going to explore the issue of sustaining life support in those with virtually no hope of recovery. First, we will discuss the brochure called My Voice and give a short demonstration on how it can be used in nursing patient care. Next, we will address interesting logistics about life support. We will then take a quick review of some articles we found on the internet, valuable or not valuable. This is what people are reading. Then we will take a look at a story about a woman who took care of her daughter for 40 years. And in our summary of all of this, we will have 2 student testimonials looking at 2 different aspects of sustaining life.
I will be going through an overview of what My Voice is and how to use it in your nursing practice. Planning for future health care choices is a wise thing for all capable adults to do. Life-threatening illness or injury can happen at any time, and it's important that those who may have to make decisions for your care, if you are unable to do so, are clear about your wishes and know they are supporting you in the choices you have made. The purpose of this workbook is to provide you with the information you need to make informed choices about your future health care ahead of time. I am now going to discuss this matter with Helen, one of my patients. Hi, Helen.
Hi.
I just wanted to be able to sit down with you today to go through this information prior to your surgery.
Yes.
So that you have everything in line and all of your choices are choices that you have made. Okay?
Okay.
So what we're going to go through today is an advanced care plan. So you might be more familiar with the term of a living will.
Yes, I've heard that.
Okay. So what we're going to do is go through a little bit of information. Now when you come into the hospital, our best yet if you can do this before you come in.
Okay.
It's a list of different options that you have if things don't turn out the best, right? I hate to say it, but I don't want your family to be the one making hard decisions.
That's right.
It's something that if we can go through together, then you have it set up and it's what your wishes are.
Okay.
And it just takes a whole lot of stress off your family. Okay?
All right.
So again, some of the benefits of having this advanced care plan is being able to reduce the emotional distress on those ones that are closest to you.
Like my son.
Yes.
Yes.
Exactly.
Mm-hmm.
And then we'll be able to go through and learn and choose from the options available.
That's a lot of options.
It is a lot of options. That's why I wanted to be able to go through this with you, so you have a better understanding of what is available to you and what your wishes are.
Okay.
Okay. Now in this book as well, there are some beautiful stories on personal information and personal sides to this as well. So an example of this would be, it's a gift to your children. So in here it says, my mother gave me a very loving and insightful gift, namely careful direction about what to do if she became irreversibly ill and unable to make her own decisions.
So it's a gift to my son to
Exactly.
get this done.
That's right.
That makes sense.
Yes. So the first part of it is just thinking basically about what you value in life, what things you hold important to you. Okay? And part of that may be CPR. Now I'm not sure if you're familiar with the term CPR.
I am. That's when your heart stops and they have to jump on you to get it going again.
Right. That's exactly it.
I'm pretty sure that I don't want CPR because I saw that happen to my husband and I heard the ribs cracking and it wasn't very pretty. So if you could just help me, I think I just want to know how to figure out which one of these things would be okay.
Okay.
Maybe
Excellent.
Those choices we could just, because I know this one, I don't want that.
You don't want that one.
That's awful, that's a mess.
Okay. So some important questions to ask yourself before going through this information is, what frightens you the most about medical treatment?
Oh yeah, CPR. That's scary.
Okay, now how do you feel about breathing tubes?
No, don't want those breathing tubes either.
Okay. And how do you feel about going into a nursing home?
I think I'd still like to go to a nursing home if I could play cards and visit with my friends.
Okay.
Okay.
So that's another perfect thing to think about, is that the ability to be able to play cards, the ability to be able to talk to your friends.
Right? That's
Okay.
Mm-hmm.
So another question would be, what does comfort care mean to you? When thinking of death, people say, just keep me comfortable. But what exactly would that mean for you?
Lots of pain meds. Like, I don't want to feel anything if I'm suffering. Just take the pain away.
Just take the pain away?
Yep.
Okay. So one of those options, it sounds to me, is that you're not interested in a full treatment. You're not interested in even a conditional full treatment because you want to stay away from the breathing tubes. You want to stay away from the mechanical ventilation, right? You don't want to be fed through a feeding tube.
No, don't want that, no.
So these two options may be the best for you. So it's something just to go through and read through, and the more we talk, it'll be, I think, a lot easier for you to be able to make a decision.
Just put a little mark, maybe one of these then.
Yes, good.
Okay.
So what you're going to want to do is you're going to want to discuss this with your son.
Yeah.
Okay?
Okay.
So there's a chance that it might be uncomfortable for both of you, right?
Probably.
But it's very important to be able to have this conversation so that he knows that it is truly your wishes that he's meeting. And it will take a lot of pressure, as I said, off of him.
Okay.
Okay, so I would suggest, even here's a great information, start by explaining that you are planning ahead for the day that you might be seriously ill, injured, or dying, and unable to communicate what kind of medical care you want. Okay? By discussing this information, you're reassuring them, you're letting them know.
So they don't have to worry if they need to pull the plug on me. It's okay.
Exactly.
That's fine.
It takes the pressure off of them.
That's
it's a decision that they aren't forced into making. It's something where they can feel comfortable knowing that they are keeping your wishes.
Yes.
Okay?
I agree.
So, some things that might be good as well is to share the information with your son about wanting to play cards and wanting to have that level of life. Because then he really can understand what's meaningful to you.
Yes.
Right?
I don't want to just lay in a bed.
No.
No.
We don't want that for you at all. And in the back section here, there's just different answers to other questions that might come up. I mean, you could take this home, you can go over it yourself so that you have a better understanding.
Okay, real good.
And then you can take this and review it with your son as well. Because it might not hurt for him to go through this. Some of these personal stories in here are excellent information on how it's protected families and how it's kept the wishes of the people, right?
Okay.
So there's even some word lists in the back as well. So it's almost like a little dictionary back here. Okay. So things to allow a natural death, antibiotics, artificial nutrition, just different things like that. Even some information on end-of-life care. Okay.
Well, I'm getting up there.
Well, and I'm not saying this to scare you by all means, and I'm not saying that anything is going to go wrong with surgery.
No.
But for anything going on in the future as well, I just
good.
want you and your family to be prepared, okay?
Yes.
So that's why we're taking the time to go through this today. Because if something happens after...
Even an organ donation.
That's
I wonder
right.
who would want my liver.
Well, you just never know, right?
True enough.
Some people even give their bodies to science, right? So then that allows... This is science. This is science.
Somebody would really want this.
Somebody might really want Miss Roper's body back.
That's right.
Okay.
I'm going to check that off.
And that, I think, brings us to the end of my voice.
Yeah, that's good.
It was beautiful.
This is some information that Bonita gathered for doing this research for this paper about the ethics of life support. So advances in medicine and technology are helping people to live longer these days. Most hospitals are facing the dilemma caused by demand for critical care beds outstripping the supply. This imbalance is likely to get worse over the coming years as a result of many factors including age of the population, improved technology, and improved therapies. Life support refers to a spectrum of techniques used to maintain life after the failure of one or more vital organs. The three purposes of life support are to establish and maintain the ABCs of resuscitation: airway, breathing, and circulation, restore the patient's homeostasis, the internal chemical, physical balance of the body, protect the patient from complications of the underlying disease and problems. Patients and families need to recognize that life support is an extremely painful, expensive, and emotionally wrenching experience. Life support exposes a patient to vast risks of further medical complications and offers no guarantee of a positive outcome. The financial cost of providing life support care is huge. A single day of life support can cost thousands of dollars, and society as a whole faces difficult decisions surrounding life support. Frequent laboratory tests of blood, urine, drainage from wounds, and other body specimens, X-ray, ultrasound, CT scans, electrocardiograms, and other imaging procedures are things that may happen during this time. The treatments also include things such as oxygen, IV fluids, antibiotics, drugs to improve circulations, transfusions, surgery, dialysis, feeding tubes, pacemakers, and various machines to assist heart and lung functions, and sedation. The risks and consequences of life support are enormous, and they include physical dangers, emotional suffering, financial costs, and societal discord. The physical dangers which could occur to a person on life support include permanent brain damage, kidney and other organ failure, infections, abnormal blood clots, skin ulcers from lying immobilized for long periods of time, and extreme pain. The emotional consequences of life support touch patients, families, and medical caregivers. These repercussions arise from the frightening environment of an ICU, the need to make life and death decisions, the anger, the guilt, and grief that can relate to life-threatening situations, and the fact that many lengthy and difficult treatments may end in failure. The need for life support may happen suddenly, so therefore, people should discuss in advance with their family and physician their wishes for the use of life support if a medical crisis should develop.
I'm going to share with you some information that Bonita found on the internet. It's about a Florida woman who passed away after 42 years in a coma. Now what's happened is the mom took care of her daughter. She went into a diabetic coma, and her daughter asked her not to leave her side before she went into the coma. So the mom kept her promise, and she turned her daughter every 2 hours. She had the daughter at home with her, and she kept this up for almost 42 years of her life. And at that stage, the mom had become elderly, and the mom actually passed away before the daughter and was in the same room in the house and passed away beside her daughter. So I guess this just would bring to point some of the ethical questions, like would the daughter have still asked the mom to do everything for her and to never leave her side if she knew that her mom would be losing 42 years of her life, and would have to go to outside sources, if they were even available or financially set up, to be able to go and buy groceries or to be able to even have a break for a few hours.
Oh.
I'm going to share with you a personal story about my husband and his family. About 12 years ago, he was in a serious car accident, and after spending a few weeks in a coma, his family was faced with a decision of whether they wanted to pull the plug or not. Now, for his family, they chose not to, and he remained in that coma for another half a month. Now, coming out of that, he has been rehabilitated, and he now has a family, a wife, children. So my point to the story would be that sometimes we don't know what the outcome is going to be, and even though there is a cost to the medicine and to the home care and health care, there is also a price for being able to watch your children grow up and be able to watch them be married and be able to live their life.
I'm now going to give you a testimonial of something that happened on the wards today during our student training times. I was working with a woman who was 89 years old, and in the morning she'd had surgery the day before, and I was with her the night before, and we had a visit. And this morning when I got to work, it was a very different situation. She was not easily wakened, and if she did open her eyes, they didn't stay open. Her pupils were dilated, her breathing was labored, everything about her was just off. I looked in the charts, and she was a full code, and she's 89, she's had breast cancer, she's got a pacemaker, she's got all these things going on. So it was kind of interesting that she was still a full code. And within a few hours of my shift, we did end up having to hit the blue code button, and the code team came over, and I watched her get intubated, and I watched all the things get poked and prodded and hooked up to that woman, and she was just a frail little rag doll. It was a very emotional day, and had it been my mother, I would have been horrified at all the things that were going on with her. So I encourage all of you and your family to discuss things that are covered in the brochure, My Voice, or get something figured out, because if your wishes aren't to have to go through that, or maybe you don't even know what a code is or what it looks like, and I don't think that I even knew what it meant before today, but now that I've seen that, I don't wish that upon anyone. So